just like any other resource that we've spoken about. Oxygen's going to be one of those areas where it may come short in supply also.
Health officials in Cameron County now working with the state to stockpile the medical equipment needed to treat critical COVID patients. And it's not just equipment. Here's Channel 5's Rudy Midelis.
Thanking the state for fulfilling a short notice resource request, Cameron County Judge Eddie Trevino Jr. and hospital administrators discussed the latest issues with rising hospitalizations. Requesting health care workers on Thursday, Judge Trevino said almost 200 nurses from around the state and country were sent to Cameron County the last several days, around 4 times the amount requested. After the judge explained staffing as a temporary move, Dr. James Castillo broke down the county's current hospitalization numbers, reminding residents that staffing alone won't stop the situation from getting worse.
172 people hospitalized not in the ICU with confirmed COVID, and 33 in the ICU. So right now, in terms of non-ICU bed capacity, Cameron County is at 131%. So we went from being at 71% of COVID beds to 131%, so over capacity.
With patients taking up to 2 weeks to recover, Valley Regional Medical Center CEO Art Garza says hospitals are having issues sending home patients, tying up beds for longer. The problem? Oxygen.
A lot of the patients in-house are on high-flow oxygen therapy treatments, and while stable, otherwise cannot be released to home unless they're released with oxygen therapy set up at home. And so that's becoming more and more challenging for home health agencies to accommodate, not necessarily because they can accommodate it, but because of the lack of O2 setups.
As hospitals work to make space, some are going into diversion status, a status that lets ambulance teams know that resources are tied up. The number changing on an hourly basis as hospitals work to make space. Cameron County hospitals have found themselves in diversions several times the last 2 weeks. Harlingen Medical Center CEO Matt Woltoff says that severe trauma patients, like those in a major car accident, would still be treated as normal in a diversion status. But those with non-life-threatening injuries could face major wait times with hospitals overloaded with coronavirus patients.
The reality is if we are on diversion, that means that things are not moving quickly in our emergency department. So it in all likelihood would mean that there's going to be some delays and it's just not, it's not going to be as efficient as we would normally be, and that's why we put that status out there. But again, it all depends on the circumstance.
Valley Baptist Brownsville CEO Leslie Bingham explained that as COVID patients overflow, emergency rooms are used to hold them, causing the long waits for some seeking care. She added all county hospitals are asking for residents to be patient and wait to be seen, so a small problem now doesn't snowball into something life-threatening down the road. In Brownsville, Rudy Midelis, Channel 5 News at 6.